I sent it, Trace.
Yep, thank you. I'm gonna go test it, make sure it's working. Yep, all right, good. Am I good?
We good to go?
Yep. Good to go.
Don't feel like we're
Good to go.
missing. Brenda, Leilina, Glenn, Kelly.
We're up and running. You're good to go, Dorby.
Okay, Dr. Van here.
He's not going to be here today. He had a very close family friend, a funeral he had to go to this morning. You're stuck with me. And there's Carolyn.
We are not stuck then anyway. Let me just make,
No, I was gonna say, that is not a problem. We are happy to have anyone and everyone, but I'm sorry to hear about his news.
Yeah. It's
okay, we do
I'm
have
sorry.
a Darby.
Okay, thank you. All right, so a meeting of the Louisiana State Board of Medical Examiners Occupational Therapy Advisory Committee pursuant to lawful notice is duly convened and called to order at 10:02 a.m. on Friday, August 4th, 2023 via Zoom virtual video. Please note any comments by the public are welcome and can be emailed to publiccomment@lsbme.la.gov. Ingrid has confirmed that we have a quorum. And maybe Tracy, can you confirm that we verified the identity of all the tele and video participants?
Yes, everything is clear and audible.
Thank you. All right. Just to review the mission of OTAC is ultimately to protect the public, that is the consumers of OT, by regulating competent practice and upholding the standards set forth by the governing rules and regulations. We have the following members present: myself, Darby Philbert, Ingrid Frank, Brenda Martin. We have Kelly Brandon is out. We have Caroline Murphy here with us. We have Raylina Crooks. We have Kimberly Delori.
no, I think it's the opposite. Kim is
the
the one that's
opposite.
not here and Kelly is.
It's
You
here.
are correct. I'm sorry. Kelly Brandon is here. Kimberly is out. Sorry about that, guys. Amy may be late, and we have Glenn, who noted that he'll be leaving at 11. Dr. Van is not here. We have Jacinta, we have Tracy, and we have Patricia Wilton. Do we have any guests?
Nobody else is on at the moment.
Great, thank you. All right, so Ingrid has confirmed a quorum. We will begin with the old business and the approval of the minutes from the meeting on July 14th, 2023. If everyone can open up those. And we can look at them and wait for a motion to accept them.
Should you share the cloud share thing, Darby?
Sure. Would you mind doing that, or do you want someone else?
I can share the minutes, but usually someone else shares the actual cloud share thing.
Okay.
But I can share the minutes. I have them pulled up.
Let's see. I have it here somewhere. Might just be easier to give it to you since we're going to have it you on later anyway.
I'll share the minutes right now. Hold on.
Thank you. Do you have the ability to share?
Yes.
There we go.
So when we had these, we covered dry needling.
Mhm. Yeah.
Darby shared drafts of other dry needling. We had Kristen Neville on. She talked about dry needling being within the scope of OT. We had the draft proposal that we reviewed and edited. We agreed on the term dry needling. Dr. Van wanted a mechanism built in for our OTs to respond to major complications. We talked about requiring a specific prescription for dry needling before an OT actually does it. We approved the draft dry needling proposal. And we went over our response to CODA regarding exposure response therapy, OTAC membership. Dr. Van is going to be our OTAC representative on Compact Commission. We had a discussion about the length of time a prescription for OT is valid and created a response for an OT.
And that was sent out. Yep, okay. I'll motion to approve the minutes as written. Mrs. Darby,
I'll second. This is Carolyn.
thank you. Tracy, are there any public comments?
No public comment on that issue.
Okay, all in favor?
Aye.
Aye.
Anyone opposed? Okay, so they are approved. Thank you, guys. Next up, we have the rules and regs. I'm gonna say that we hold off on that just for a minute so that we can do the new business real quick. And that way, once we get started, we can finish. So if we scoot down to new business, I'm not sure if y'all received or got a chance to look at the email from LOTA yesterday about their updates about the legislation, everything that passed that involved OT. It's quite extensive. So, but LOTA did announce that they were having a town hall meeting. And
Darby, can we just take 1 second to verify who just came on? It's from the number 504-405-1127. Can you just identify yourself, please?
Yes, it's Amy Lariviere.
Okay. Thank you.
thank you.
You're welcome.
Welcome, Amy. Okay, so we'll go back to the town hall meeting. This is number one under new business, just so you can catch up, Amy. So anyway, they're having a town hall meeting that's a virtual meeting to bring the members together to discuss the legislative opportunities and current events. And it's Wednesday, October 23rd, 2023 at 6 p.m. And it's an open floor format. Obviously, it's a Zoom, and they've asked panel representation from OTAC. So I, as of right now, am able to do it. And if not, then I will come to the committee for backup. But basically, we're just gonna be a part of this panel that is gonna talk about the things that have passed, like the telehealth bill passed, the compact bill, and a lot of other bills went through that OT has been named in. So that was really exciting. But now, you know, we need to come up with people to help implement our involvement. So I just wanted to let everyone know about that. If you have any questions, let me know, or you can ask now. But the email went out from LOTA yesterday. Y'all need to refer to that. Do you have any questions? Nope. Any public comment?
No.
Okay, and then just a quick announcement that congrats to Carolyn Murphy. She was informed by Dr. Van that her appointment was renewed. So we're so excited that she agreed to serve another term. Thank you.
Thank you.
And resumes for the two positions that are open are due August 31st. And I kind of wanted to get y'all's input of whether or not you felt like we should send a reminder email. I don't even know that it's possible, but I would guess that it is. Just given the fact that it's been a while since the original one went out, and they're due at the end of the month with school starting and a lot of transitions for people at work. So what are y'all's thoughts?
I think that'd be a great idea if we can do that.
Okay. So I'll work on that and try to include a little bit more details in the one that went out previously. You know, the questions that I got were like, do you get paid for it? Where are the meetings? How often do you meet? And a lot of that depends on who's going to take over next year, as to like, you know, if y'all still feel the need to meet monthly or you want to go back to quarterly. But anyway, so I'll get on that. So that's all. Any public comment regarding the reappointments there?
No.
Okay, great, thank you. All right, so let's go back to the rules and regs. So the first thing I have, kind of, not that we forgot, but on the list, but it kind of involved more with dry needling, was the physical agent modalities. So I did not send on the cloud share, my apologies, but I kind of warned Ingrid ahead of time that I had originally sent y'all the physical agent modalities document from the other states in a chart format that I'd highlighted for everybody. And so I think, Ingrid, if you don't mind pulling that up, I know you just got to where you were going in that, I see. Sorry. I don't think this is going to take long. So basically, when she pulls that up, if you look at Florida, Georgia, and many of the other ones, they
I have it pulled up. Can you see it?
yeah.
Okay.
If you scroll to Florida, it just is an example. Like, I'm not saying we can't look at all of them, but basically a lot of states, and this is kind of what I'm thinking, unless y'all disagree, and definitely open for discussion, just include like the application of physical agent modalities in the definition of OT. And so it's not its own section. Now, some of them do their own section, but it's stuff like administering medication and things that don't apply to us. But I'd like for us just to consider like maybe throwing that in, and then fine. There was another state that defined it kind of quickly that I felt like Georgia.
I mean, Florida includes it in their definition of OT, but then they do go on to have a lot of stuff.
Yeah, well, but that's like prescription devices. So I'm just talking about like the example of how it's just briefly mentioned, but
Okay.
then Georgia mentions it right there. See how they mention it, like occupational therapy includes but not limited to the following, and then it just lists like things, you know, cognitive activities, therapeutic exercise manual, and then physical agent modalities. And then they define it under number 12 right there. Physical agent modalities means that occupational therapy treatment techniques, both superficial and deep tissue, which may, but are not required to use the following agents. I don't necessarily feel like we need to list everything like that, but something to that. Like some states get into like how many hours you need for each one of training. Now we're doing that for dry needling. There is one state, and I'm trying to find it because I wrote it down, but I can't. Let's see, is it Idaho mentioned something about an occupational therapy assistant may apply deep thermal and electrotherapeutic modalities under routine supervision if they have obtained an advanced level of skill. I don't know if we want to put something about that, whether or not they can do it right there.
Can y'all hear me?
Yes,
A little
Okay,
low,
good.
but yeah.
It's low? Okay, I'm sorry. I don't know what's wrong with my speakers. If you don't put that in there, does it imply that OTAs would not be able to?
I mean, unless it was spelled out specifically, like what OT could do, what OTA could do, I don't think that would prevent. I personally, I kind of like the concept of keeping it just very simple. This is what physical agent modalities are, and they should be in preparation for functional activities. But then keeping it very, plain and simple. Because I think once we start listing, then we will never finish this process of updating rules and regulations that will go on for 87 years.
and another Pam will come out tomorrow.
Exactly, that's what I meant. Like it'll just
Yeah.
keep evolving. So I think if we keep it simple, and then when we know there's something like dry needling, those should get addressed. But I like the concept of just keeping it very simple, and OT can do physical agent modalities in preparation for functional activities.
And an OTA once
Right.
it's been out of.
That was my main question, not necessarily, oh my gosh, I'm sorry, not listing which ones they are, but that an OT practitioner can.
Right. Yeah, definitely a practitioner.
I would definitely support practitioner.
Mhm. Darby, you're muted. I don't know if you're saying something.
Did Darby text me just now? She lost her connection, rejoining now.
Oh, okay.
Better?
There she is.
That happens at her house at like 10:20 frequently. It's weird. She's got some
Okay,
weird
I'm back.
poltergeist. She's got some weird poltergeist at her house, Darby, that strikes at 10:20 every day and takes your Wi-Fi away.
Okay, yeah, well, our internet's actually been out since 2 o'clock this morning, so I'm on a hotspot, but I think it was Kelly asked if you could hear, and I went to turn the volume up and I hit the airplane button. So put it in airplane mode, so I had to rejoin.
We were just saying that those of us who had kind of talked about it, that we would in general support language of occupational therapy practitioner in the application of modalities.
Yeah, definitely. It's just how do we want to insert it? So if we want to just include it sort of in the definition, then I gotta get out of this view because I wrote down
I'm just going back to Florida's.
yeah, like on page 13 of the rules is where our definition is, if we want to put it in there. I mean, I just think that's sort of the simplest thing to do. I don't want it its own section because we're really not saying that much about it, unless y'all feel like we need it.
I like the idea of putting the definition, the fact that we apply physical agent modalities in preparation for function that in the definition of OT. I like that.
Yeah. So like
I like
Florida
that.
has right there.
Yeah, I love the way Florida has it written.
Okay. So maybe Ingrid, if you pull up the rules, page, like, I think it's page 13. I tried to clean ours up a little and get rid of the big spaces. I have the Florida one here on my screen and I can just call it out, like, if we want to add it similar to that. Now, the other thing is we probably need to address it somewhere with the practitioners.
Wait,
You're,
I
you
must
need
not
to
be, I must not, I don't think I'm on the right thing.
not.
I am definitely not. Too many possibilities here.
I know, I'm sorry. I have like a million windows open too, but
It's, yeah, it's over there. Okay. Got it. I'm gonna go into page 13.
I tried to get rid of all the like huge chunks of space.
Okay. And then are we going to the definition of occupational therapy right here? That's in red?
Yeah. Is that what y'all thinking? I mean, because really nowhere else. The other part that I thought about is like under the intervention section.
No, I like it in the definition. Practice
Okay,
includes.
maybe in the intervention section, we can mention this thing about practitioners or something. Let's figure out where in here it would go.
I like putting it in the definition, but then I think like down the road, somebody looking to see what it says might go looking at the intervention section. So we may want to make sure that what it says in there matches or whatever, or gives the answer.
Our definition is really, our definition of OT is quite, we must have taken this from
AOTA.
AOTA, yeah, but it's different from Florida's, which lists a lot of things, specific things that OT does. So let's see, OT services include habilitation, rehabilitation. We could get rid of the word and, the promotion of physical and mental health and wellness, and the application of physical agent. Does it fit right there, or is it just its own new sentence?
I don't know. It seems like it's just kind of out there because we don't really talk
Yeah.
about like therapeutic activity or.
Right, I know,
Right.
exactly.
I feel like if we put PAMS in the definition, we need to put all the types of intervention in the definition.
Yeah, I feel like that too, like kind of how Florida does, like.
Our definition is simply really different than our current definition that we've got here. Is just very different from Florida's, and it doesn't really feel like it's as fitting here.
Yeah.
So
And-
I mean, it could be just its own.
yeah, I guess it would be like after where it says and provide occupation-based intervention to address them. That would be the place to put the interventions.
And occupation-based intervention and the application of physical agent modalities as.
Yeah.
In
Yeah.
preparation, or yeah.
Let's see here, and provide.
Is there a different section where it goes into the types of interventions?
Well, I think it would be in the intervention section that we worked on like a few meetings ago, but remember how we laid out like, it was like referral, evaluation, and it was like program planning, intervention. But I didn't really see a place that like, it didn't sort of stick out, but I think that's also kind of where we talked about the roles of the assistant, so that we may have to mention it again there, just so we can say that that the assistant can perform this, because I don't want it to not be addressed, then it be an issue. And it maybe, in a part where it was like the therapist determines whether or not the assistant can do it, we can say like such as physical agent modalities. And then I think maybe if you italicize physical agent modalities, we need to add that to the definition.
It just seems like something that's kind of just stuck in there when there's so many other things that could also be, I don't know.
It does feel stuck in, but we definitely purposely did not want the long list, because OT, just the things that OTs do are always changing.
Right.
But at the same time, the physical agent modalities one is just one of the areas that comes under the more scrutiny, and so I like the idea of having it here. Does this make sense now? Occupational therapy practice includes clinical reasoning, and professional judgment to evaluate, analyze, and diagnose occupational challenges, the provision of occupation-based interventions, and the application of physical agent modalities as an adjunct to or in preparation for purposeful activity to address them. What are we referring to with them? Oh, occupational challenges.
I'm curious, and I'm sure we've already discussed this, I probably should know it, but does AOTA in their definitions, which I'm thinking not, because I'm thinking this is their definition, does it include physical agent modalities? And if not, do they have like some sort of draft model practice act or something in that, do they like recommend like a section where it goes?
Well, in the OTPS, there's a list of the interventions, and it's just occupations and activities, interventions to support occupations, education and training, and advocacy. So I just didn't know if we could just list the types of interventions and then put in the interventions to support occupations, including but not limited to physical agent modalities.
And the other list that you just gave, I like that.
Yeah,
So look at Georgia.
says-
The list you just gave is a lot more less specific than
Yeah,
I had before. I like that.
and that's what the OTPF is, and it doesn't, it has specifics, but we wouldn't have to list them all, but since you
Yeah.
said Pam's is one of the big, difficult ones, then we could say including but not limited to. Because there's a lot other, but they don't call them prep anymore, they call them interventions to support occupation.
Okay.
Oh.
So can you kind of like restate that for me? So would it go in this
sure.
sentence? Occupational therapy practice includes clinical reasoning, the provision and judgment to evaluate and diagnose occupational challenges. Can this, what you're about to tell me, be a continuation of this sentence?
Sure, it could be the provision of occupation-based, well, they call them occupations and activities.
Okay.
Occupation-based and purposeful activities, maybe.
I mean, we can put it the way you just said it, like from the OTPF, and then see what we think.
Okay, the list is occupational therapy intervention types include occupations and activities, interventions to support occupations, and that's where I thought you could put including but not limited to physical agent modalities. Education and training.
Hold on. Education and training.
Advocacy. And then it also has group interventions and virtual interventions.
Let's see if that sentence makes sense. Would including but not limited to Pam's be in parentheses?
I don't think.
I would think so.
Just like you have like the EG above in parentheses, so it probably would match that.
Yeah. But it's not really an example of.
No, it's not, but I'm just saying like that's
Yeah.
in parentheses and not like.
Right.
I'm wondering if that whole thing needs to just be a separate sentence. Clinical reasoning and professional judgment to evaluate, analyze, and diagnose occupational challenges. And then at the end of the parentheses, period.
Okay.
And then,
What was it? How was it you
OT
started that
intervention
sentence?
types include
Say it again.
occupational therapy intervention types include, and then list.
Include but are not limited to.
No, it would be all of those things, but the including but not limited to PAM goes under occupation interventions to support occupation. But those are all the types of interventions, all however many that is. 1, 2, 3, 4, 5, 6. The types are occupations and activities is 1. Interventions to support is 2. Education and training is 3. Advocacy 4. Group is 5. And virtual is 6. And then PAMS is one of the interventions to support. So then I think you could take that part out, yeah.
I like it better as 2 separate sentences.
Mhm.
Does it need to say the provision of,
Say it again.
where it says occupational therapy interventions may include the provision of, or can it just say may include?
Yep, you're right.
And are you going to spell out PAMS or?
I would, yeah. I was just doing
Okay.
that for the fast typing.
Yeah. And then just make it italic so we'll know to catch it to go back for the definition.
Do we have anywhere in here, I'm sorry, I should probably know this, to refer to the occupational therapy practice framework?
I don't think.
Yeah.
You can probably search the document and see if the word framework is in there. I can do that real quick while she's doing that. How, do you know how often that gets updated?
Too often.
Every 5 years.
3 to 5
Yeah.
years.
I just
And
redid the whole
it usually
practice framework.
changes pretty significantly. So I don't think we need to use specific terms because they tend to change the terms.
Right, yeah.
That's why I was wondering if we should put the OTPF as a reference, like to the most current.
Yeah,
'Cause
the
they
word
changed-
framework is not in here.
They changed, you know, the preps to interventions to support, and then, Carolyn, do you remember what else they changed? I guess they added virtual, which we needed to do anyway.
If we were to refer to the OTPF, I think it would be in the section about evaluation and intervention that we created that comes after this definition section. But with this definition section, this is a whole separate thing that we're going to have to do. Like after we actually write all of the sections, then we need to go back and look and see what words need defining.
Right.
So, for example, if we want to reference the OTPF in the document where we talk about assessment and intervention, then we will include a definition of the OTPF here in the definition section.
I think it'd be a good idea to add it to the definition, because I don't know that a lot of people know what it even is.
I'm not opposed to, but we don't want to have definitions of something we're not using. We first have to see if it's appropriate to use it.
Right,
And
if you're not going to actually refer to it. Yeah, that's right.
Well, but
we're not going to have definitions of things that we don't use in this document.
Right.
If there are places in the existing rules or even the new rules where you think it is beneficial to incorporate that, and then having it as a defined term is good.
Mhm.
For example, I'm here under evaluation A, and this is language we did not change. Occupational therapists shall evaluate clients' performance according to the current AOTA guidelines. So that would include the OTPF. If we feel like we want to be more specific and say to the current AOTA guidelines and current occupational therapy practice framework, we can do that.
Or we can put a section A like that under the implementation, like more of the treatment section.
The OTPF covers both. We would need to.
So you could put it there if you feel like it's important.
Well, it also, but in the OT definition, we talk about client factors, performance patterns, and all of that, and those are OTPF terms, don't we?
Right. Anything that we wound up using in this document, we're going to make sure that there's a definition for it, but we don't do it the other way. We don't like create a definition and then. So let's see where we get to. Evaluation. Are we still under evaluation? Intervention process. We don't reiterate. It does not look like we reiterate anything here about using current AOTA guidelines or documents for intervention. But we can.
This is an ignorant question on my part, but is the framework document incorporated or under the umbrella of the general AOTC guidelines? I mean, is it a component of those, or is it a completely separate thing?
No, to my way of thinking, what we have here under evaluation A, this statement would include the framework.
So if and I'm not where the definitions are, so I'm not sure, but can we clarify a definition of AOTA guidelines to include the framework thing?
Yes, we could. Mm-hmm.
Well, see, I feel like the AOTA guidelines, as far as the roles and responsibilities, is a separate document, but on B, where it says the demands of occupation, the client's body functions and structures as outlined in the current, that should really be AOTA, Occupational Therapy Practice Framework, Domain, and Process. That
You're right.
terminology is
Actually,
in the OTPF.
you're right. We do. This is basically the framework, and we don't really have it written right.
But the roles and responsibilities and standards of practice are totally different documents than the OTPF. The OTPF just covers like what we do and the process in which we do it, but not necessarily who does what.
So maybe in the definition of OT, we can include those things like referring to the guidelines, the scope of practice, or the framework. Like you can just list the documents that could be referenced for OT, and that would be all inclusive. So it's not in the eval section, it's not just in the intervention section, but it's really everything.
Yeah, because there's their official documents are very helpful, and it would be
So
they're more
this,
specific.
would y'all have a problem if I change this AOTA scope of practice to AOTA occupational therapy practice framework?
Domain and process. Mhm.
I'm fine with it. I think maybe in the definition, we need to list all the documents that could be referred to. Because even
It's
in the,
gonna- Again, like now that we have referenced the AOTA occupational therapy practice framework, we've got to have a definition for that.
but so you see A that we didn't change in the definition section, there's nothing about the AOTA
What do we
guidelines.
mean by that? Yeah, I agree.
So would it be safer to then where we, like even in B, where we say, as outlined, again, use AOTA guidelines, and then our definition would say AOTA guidance or guidelines, means guidance gained from the practice framework, from the scope and practice document, from the documents that as OTs we should be knowing about and referencing.
Yeah, I think instead of trying to go through each and every one and say where, if it derives from the practice framework versus other general guidelines or whatever, if somewhere in the opening parts, definitions or what have you, you refer to source documents or whatever, and you include anything that you think you should specifically direct people to, that's better than trying to go through and assign each one of these to one of those documents.
So maybe Ingrid, you think we should go to page 1 under the definitions and just put in AOTA guidelines and then just put a note for us to reference the documents so we don't forget.
Yeah. What page am I? My question though, before we move on from this, is whether we should have a statement about using current AOTA guidelines and practice framework in the introduction to our intervention section.
Well, I think that's what Patricia was saying. Instead of putting it in each place that it involves, like for us to reference all those documents where like, so that they could be used for everything.
And if the guidelines are a discrete document, I mean, if you go to somewhere and you print out guidelines and then you go to another place and you print out practice framework, then come up with a more general term that's inclusive of everything, whether it's AOTC guidance, AOTC references, whatever. If you need to have another global umbrella, yes, to include everything that would be relevant, then, because I agree with you, Ingrid, that part right there, if the guidelines are not the practice framework and the practice framework is really what that's derived from, then saying guidelines isn't the right thing to say. But if you get a more generic term that says AOTC guidance or whatever, pick a word, and it's inclusive of everything, then you could just use that everywhere.
What are you thinking, Kelly?
I'm confused. I'm sorry. I could see where we could have an umbrella term for things like roles and responsibilities and standards of practice, but I don't see where we could include the OTPF within that umbrella because it's really separate.
Yeah, I kind of agree with Kelly. That's why I would like to have the OTPF just here in the intro to the eval section and the intro to the intervention section.
Okay.
I mean, the OTPF it defines all of these terms that we're using, like body functions and structures. It defines what the evaluation is, the occupational profile, what kinds of outcomes you measure. So it defines all those things, but when we're talking about who is responsible for what in different parts of the process, the official documents like roles and responsibilities and standards of practice, that would be, we could say AOTA official documents or something like that. But it could, so if we put it in evaluation and intervention, we would also need to put it in outcomes.
Yes.
Mhm.
And do you think that the section right above there, instead of saying AOTA guidelines, that we should say AOTA practice documents? And then list the ones in the definitions under practice documents?
I think they call them official documents, but
That's what I meant, official documents, yeah.
okay.
But just instead of the word guidelines. Because it's more than guidelines, you know, the frameworks.
I'm just looking at the intervention one. And OT
I don't know if that said anything.
has overall responsibility for the development of the intervention plan.
Like, the OTPF doesn't really say who all is responsible. It just says what it is, right?
Mhm.
So the
Whereas you're
official
saying that
document-
this paragraph is really about who does what as opposed to what.
Right. That would be outlined in the official documents, but the intervention types, the approaches, the process of it, all of that.
This
would
is
be
here
in the
then under
OTPF.
B, intervention plan development. Intervention plan development shall be based on the evaluation, client goals and outcomes, best available evidence, professional and clinical reasoning as outlined in. Does that look okay?
Is it specific to the practice framework, or would it be, would that be a place where we could put official document?
Yeah, I don't know if that's a place for the OTPF.
Yeah, I'm not sure that like professional and clinical reasoning is outlined in the OTPF.
So if we say official documents, would
Yeah.
that consume it all? So, and then maybe in the definitions, we can just list all the documents that we would be referring to.
The clinical reasoning is, believe it or not, in there. Isn't
I
it?
just,
Yeah, isn't it part of therapeutic use of self in intervention in the OTPF, Kelly? For sure.
I
But
think they actually took that. Let me see.
but maybe this isn't the right word. It doesn't have to be outlined. I mean, it can be informed, as informed by.
I like that. Or maybe instead of like shall be based on, shall utilize the evaluation, client goals, available evidence, professional and clinical reasoning. All is informed by AOTA.
Shall utilize.
Mhm.
What's at the beginning of this stuff, of the intervention section?
Everybody comfortable with that?
I'm just gonna look at the outcomes real quick before we go back to the definitions. Do we have a section that's called outcomes, discontinuation?
Mm-mm. No.
No.
Hmm.
It's about change. Okay. All right. And then up here in the definitions, what page was that?
1.
One, our definition.
Yeah, it's section 1903. Right there, so where it
Okay,
starts.
yeah. Okay, so we need to include occupational therapy practice framework and AOTA guidelines.
Okay. All right, so can you go back to that section so we can vote on those changes? It didn't seem like there were more definitions.
I don't know, oh, there. Here it is. Eval 4911B.
Okay, so we need to vote on that section, right?
Correct.
Okay. Someone make a motion to adopt these changes, section 4911.
I make a motion to adopt the changes.
Who was
Kelly,
it?
I'll
Was that
second.
That was Kelly, sorry.
Oh, Kelly, okay.
Darby will second.
Darby second.
Yes. All in favor?
Aye.
Anyone opposed? Anyone abstain? Any public comment? Where else did we change?
Yeah, intervention.
Yeah. And then we also need to go back and do the PAMS thing.
Yeah. Somehow I scrolled right by intervention. Let's see. Here we go.
Right there.
This is
All right, so-
section 4913B. That's what we changed.
Okay. I'll motion to accept the changes. This is Darby.
Okay.
I'll second.
I'm sorry, was that Brenda?
Yes.
Okay.
All in favor?
Aye.
Anyone opposed? Anyone abstain? Any public comment? Okay, and then where did we add the PAM thing? Did we do that? Was
That was
that
the definition of OT.
okay? So that was page 13, I think.
Oh,
How'd
that
that get back in there?
page 13, huh?
Yeah,
We have definitions all over the place.
I know. I can't wait to clean up this document. Like I'm like really looking forward to it, honestly. I'll think that's weird, but
Okay,
Okay.
the green part is what was we added.
right. So that's gonna be section 4901 B under regulatory. I think, yeah. We just need someone to motion to accept those changes.
This is Ingrid, I motion to accept.
Okay.
Kelly, I'll second.
Okay, Kelly second.
All in favor?
Aye.
Aye.
Aye. Anyone
Aye.
opposed? Nope. Any public comment?
There's
No,
public comment.
Okay, thank you. All right, so does that take care of, now do we want to put do you want to look at the definition of Pam so that we can put that in the definitions? We go back to the chart and look at Florida, I think, or Georgia, they had the definitions that were. I can find that again. Georgia.
Georgia has it.
Wait.
I'm on Florida right now.
Okay, let me look
I
at
don't
Florida.
see a definition of Pam's here.
Yeah, go to Georgia. Please. All right, so you see where it says number 12?
Mhm.
Right there, physical agent modalities means occupational therapy treatment techniques, both superficial and deep tissue, which may but are not required to utilizing the following agents: thermal, mechanical, electromagnetic, water, and light for specific therapeutic effects to promote functional outcomes. Thoughts, feelings?
Does dry needling fall into the word mechanical?
I thought that it would fall under the deep tissue.
It's something that we want to avoid listing specifically.
No, because we have a section of it.
Maybe my opinion is because it's kind of like a pretty big significant thing that's happening right now. Maybe it's something that we could list because it's something that like maybe other disciplines are going to go to and look and see if we, if we make specific mention of it, if we allow it, if we can do it, it might be something to highlight. Now, I know that kind of gets murky whenever, like, what's the next thing that we're going to do or highlight or whatever, but maybe because it's like it's like the next big kind of thing that's probably going to be that prevalent, adopted, and then stick around for a while, that it might be good to make mention of it, but that's just my opinion.
I agree, because the deep tissue is where you're going to use the dry needle, but the dry needling is an agent, and it says, and use the following agents. So if dry needling is not thermal, mechanical, electromagnetic, water, or light, then we would need to add another category.
Going
Yeah, I
back to
think it would be
OCS
good
again.
right there. I think that'd be good.
I don't know if I'm reading it wrong, but that whole statement makes no sense. Physical agent modalities means OT treatment techniques, both superficial and deep tissue, which may but are not required to utilize the following agents. Physical agent modalities are not required to utilize. I mean, every way I break it up, I don't see where the sentence really makes that much sense.
Okay, look at Montana then. That's another example. I'm trying to go through them and find other examples. Montana is going to be like page 35 of that document. It's kind of far down. I'm just looking at other examples for us. I kind of agree with you. I had to keep going with like the word not in there through me.
So do we need to say the thermal, the light, and all of that, or can we just say what it's used for, like modalities, devices, and techniques that decrease pain, assist with wound healing, edema control?
Well, I mean, I think it takes it away from like deep tissue massage or like cranial sacral or something like that, I guess. I don't know the answer. I'm just I was like, oh, do we even go there? I mean, Montana gets a little bit more specific because it says like may include things. Thanks, Glenn. So there's its physical agent modalities, means those modalities that produce a response in soft tissue through the use of light, water, temperature, sound, or electricity. They're characterized as an adjunctive method used in conjunction with or in immediate prep for patient involvement in purposeful activity.
Where are you? Okay.
Oh, I'm sorry. I thought you were in Montana.
Okay, now I am. All right, now I'm
Sorry.
there.
Superficial physical agent modalities include hot packs, cold packs, phototherapy, paraffin water, and other commercially available superficial heating and cooling devices. It's limited to the shoulder, arm, elbow, forearm, wrist, blah, blah, blah. I mean, I don't know that we need to go this much detail, but it just gives you an example. Like, we could cut it off like after for patient involvement in purposeful activity, like the first two sentences.
I like the first two sentences.
I do too. I don't think,
I think that's clearer than the other one.
Yeah.
Yeah, I do too. I agree. Like,
But I don't think we need to list it all out.
yeah. I mean, and do we need to incorporate dry needling? Is that like you could just
The
put,
only reason we would have to is if we don't think dry needling is either light, water, temperature, sound, or electricity.
yeah.
Can we say in mechanical devices? I mean,
That's why I was asking earlier if dry needling would be considered mechanical, and if it is, you know, I like that word.
Or do we say like monofilament needles? I don't know. Like, I mean, you do, the best practice is they hook it up to the unit. So I guess that makes it mechanical, right? I mean, that's where the evidence is. Some people do the dry needling without the stem with it, but
Or either mechanical or electrical.
yeah, maybe electrical devices.
Is it on their definitions? I see the superficial. Is there anything about dry needling? I don't know if they.
I feel like it's
included.
47 screens open in our thing that we put together on dry needling. What do we call it in there? And then do we use those words to
Yeah, that's what
stick in here?
Yeah.
I just closed a bunch of screens because I was losing my Zoom connection because I had too many things open.
I've also sort of just lost where like my share. What am I sharing with y'all right now?
Give me, you're sharing the.
I'm still sharing the PAMS
Pam.
chart. Okay, good. Okay.
I'll pull up the dry needling thing and see. I can get that. I don't think I need to.
Isn't the dry needling within our rules and didn't you add it?
Yes, it should be in there.
Yeah. You added it to the very end?
Close to the end, not the very end, but close. I'm trying to find the page for you. Dry 24, page 24.
Okay, dry needling
Field intervention.
that uses a thin filiform needle. Just trying to think if there's a more generic way we can express this.
So it just says, as with other physical agent modalities in occupational therapy, it's utilized to ultimately improve function. It doesn't really say. So I think if we put like electrical device, I think that would cover it.
It's not always used with electricity, so that wouldn't. I think the word mechanical needs to be there. I feel like mechanical might be it, but
Okay.
I don't know. I'm trying to like Google.
Well, could we put like mechanical and then in parentheses, like for example, dry needling?
Yeah, that's a good idea.
Just do that, and that way people know what we're referring to.
So let me quickly go back to that was Nebraska. Let's see. Like the first two sentences here. Those produce physical preparation. Okay, we like these two.
Here's one definition. Dry needling is a mechanical modality technique.
There we go. Bingo.
Thank you.
You nailed it, Ingrid.
Thank you.
Thank
Okay, where were we on, where did we
Thank
want?
you,
this-
Amy. I'm looking.
Where did we want this definition to go?
In the definition.
Is that what we were doing? We were working on a definition for PAMs?
Yeah,
And would that go near the page 1 definitions or
Yeah.
the page
Yeah.
13 definitions?
no, I think 1.
Okay.
On page 35, it's Ms. Montana.
Yeah, I did already.
Oh,
copy.
okay.
So-
Sorry, I was
So
looking for it.
we're gonna be here under, right before the word person. No, right after the word person. Okay. We might not even keep the word person. I don't know. Physical agent modalities. Through the use of temperature or mechanical devices, mechanical.
Yep.
I'm just gonna reference that. We got this from Montana.
Okay. There we go.
I like it. It's nice and open.
Yeah,
Mhm.
okay. Need to vote on that.
I move to approve that definition of PAMs.
Okay.
I second it.
That was
Was it
Carolyn.
Carolyn?
Carolyn, yeah. Do we need to change that to green?
Yes, thank you.
Ingrid, I know you're
All in
like juggling a
favor?
lot of stuff over there.
I know, I try to take notes for her too. I don't think I'm the issue. All in favor, please say aye.
Aye.
Opposed? Abstain? And any public comment?
No.
All right, we can cross Pam's off the list now. Yay, go team. I think the next thing that we should do, unless people need a quick break, is the shorter one, which I think is gonna be the unlicensed personnel.
Okay.
I don't know, y'all read them both. Y'all can, I'm open to your suggestion.
I think that'll probably be the easier one. 'cause it's
Yeah, I mean,
shorter.
telehealth, I just gave you a bunch of options. Like, I feel like you pick one, read them all, and then pick the one you like the best, but.
So just to remind everybody that we had created a section called supervision of OTs. We didn't create it. We already had a section called that, right?
Yeah,
Just trying to find it here.
Need help.
OTA supervision of occupational therapy assistants. So we had already agreed on everything related to supervising an OTA.
correct.
And we felt, and assessing an OTA's service competency, documentation of the supervision of an OTA. So then we came to supervision of unlicensed and temporarily licensed personnel. And then when I was working on this, I realized they are completely separate animals. If we have to look at our temporary license thing, that's a whole other thing. So
Yeah.
all I focused on creating a draft for were unlicensed personnel. And so I'll share the screen with what I created on that then.
Yeah, and everybody should have access to it.
Mhm.
I've reviewed it. So basically, this section is supervision of OT aides, volunteers, and other unlicensed personnel. A, the rules of this section govern supervision of any unlicensed personnel that is supervised by an occupational therapy practitioner in any clinical setting. I question the word clinical there.
Oh, should we just say in any setting?
Yeah, in case it's like home or things like that. That
Yeah,
was my only feedback.
I like
B,
The word I stumbled on when I started reading that was personnel, because to me that implies like only like a big department full of people where I might just be working by myself and have an aide working with me. Would person fit better there? Or I'm just not sure. I just feel like the definition of personnel, and I'm not sure on this, is more like.
It's a term that they use, that I think that AOTA uses to define personnel versus practitioner. Isn't that right, Ingrid?
I
They say
probably
personnel
got this
includes
more from
tech.
California. I probably wasn't using AOTA so much as other states. I can see under C as
Okay.
California.
I think that they use it to define, to include aides, techs, things like that. And then they differentiate between personnel and practitioner by that word.
and I think it could be more than one too. So like I could be supervising multiple volunteers, which would then be personnel on that person. That's how I took it, like that it was kind of more plural, but not a practitioner.
Okay, and where I just, and it may not even matter, but like where I went with it is that like the definition of personnel just in general is someone employed in an organization. So I guess I was just thinking like bigger hospital or whatever, and wanted to make sure that people knew that this meant like anywhere you have an aide.
Yeah,
Volunteer.
well,
Does-
I mean,
Yeah, does
that way-
volunteer, I'm sorry.
if we put any setting versus any clinical setting, so then like taking out the word clinical, I think helped me because we're not always in a clinical setting.
True.
But is
Caroline?
a volunteer considered a person, part
When
of
they're not
personnel?
employed.
Right.
Yeah. We could,
Um,
Or volunteers.
our
So-
volunteer, yeah.
There you go. I think that reads better.
Is it plural? Is volunteers plural or singular?
You're saying any volunteer. I think it's singular.
Oh, look, I kind of almost define it in B.
And shouldn't it be governed supervision of all unlicensed personnel in any setting?
Instead of repeating the word any.
Yeah, any, like, the rules of this section govern supervision of all unlicensed personnel or volunteer. And then I think it should be S, and all volunteers that is supervised by an occupational therapy practitioner in any setting.
There we go.
Okay. B, the supervising occupational therapist shall at all times be responsible for all occupational therapy services provided by unlicensed personnel, which includes but is not limited to a rehab or OT tech or aide or a volunteer.
Would it just be services? Like I feel like, I don't know, I guess I just find it a scary thought that OT services are provided by unlicensed people.
Or a volunteer.
So would it just be the OT is responsible for all services provided?
I like that. I like
And
that a
then
lot.
assume that the OT knows they're not supposed to have them doing the OT.
Yeah.
I like that very much. Also, in the definition section, we could have the definition of unlicensed personnel And then in this section, it's just, if our definition of unlicensed personnel includes volunteers as long as the text, then in this section, we don't have to keep repeating ourselves.
Right,
It would just be the rules of this section govern supervision of all unlicensed personnel.
period. Yeah.
Vision- Yeah.
And then just
But aren't
copy
we-
that right there and we'll pop that in the definition section.
But we're not including volunteers as unlicensed personnel, right? We're including them as a separate category, separate.
No, we were including, at least if you look at letter B, I did include volunteers as part of being an unlicensed personnel.
Well, even the title is.
I mean, I think that volunteers should be in this section, but I don't think that they're under the umbrella of unlicensed personnel. Like
Correct.
it would say services provided by unlicensed personnel or volunteers. Like
Oh, so
they're-
that should be the title of the section.
they're not personnel. They should be included in the section to cover, that they might be there. But I don't think that they're considered unlicensed personnel.
So would it read better to have the section be called unlicensed personnel or volunteers?
But a
So does
volunteer
that
is
mean
an
someone paid, that's not licensed, so someone I'm paying that's not licensed to go get my patient or do whatever else I let them
Right.
do, or a volunteer that's playing the same role. So it's like paid versus unpaid, because how is an OT aide different than an unlicensed personnel?
Right. So, I mean, I think it makes sense to say supervision of unlicensed personnel and volunteers.
We can do that.
And then
We
the-
also literally can define unlicensed personnel any way we want. If we
Right.
want unlicensed personnel to mean rehab and
Okay.
OT techs and aides and volunteers, then that's what that is. We can.
Okay, well, that's
define
fine.
it.
Yeah, so it's in the
That's fine.
definition, but what they're saying is that the title should be supervision of occupational therapy volunteers and other personnel. Like take out the word aides. And then the definition, we include OT tech and aides.
Supervision of unlicensed personnel and volunteers.
That's what I like, yeah.
Okay.
I mean, unless you're including volunteers as unlicensed personnel, but. I
No,
see
because the
them as two
definition of
distinct.
personnel said that they were employed.
Right.
Which would mean they were paid. I like this, but you make sure we add, we make sure we keep the tech and aid in the definition.
Yes. And then you can just add or volunteers to be, or and, yeah.
And then we probably should define volunteers in our definitions.
Yeah. Maybe paste that at the bottom so that we remember for the definition. What you just cut.
Yes, we need that. We need to create definitions.
Are B and C trying to say the same thing?
But Ingrid, paste what you just cut because I want to make sure we don't forget to put aids and text, like you defined.
Oh, now I see what you're talking about. Mhm.
Yeah, like I don't want to lose that because
Okay,
we took out the word aid. Just paste.
I have to go back and redo here.
No, you don't. No, that
Well, I
like,
did.
it wouldn't let you just paste it.
Wouldn't it? I don't know. Regardless, there we go.
Okay, I'll read C while she's doing that. The supervising occupational therapy practitioner has continuing responsibility to follow the progress of each patient, provide direct care to the client, and assure that the unlicensed personnel do not function autonomously. I kind of like the supervising occupational therapy practitioner has continuing responsibility to assure that the unlicensed personnel does not function autonomously. Like if you take out that middle part and just say like, you have to make sure that that person does not function by themselves.
I included this California thing because even though it's sort of redundant to be, I agree with Darby that I really liked the emphasis on that they cannot function autonomously.
Yeah,
Yeah, I do like that piece of it.
it's just the middle, I feel like is a little,
Yeah, could it just be continuing responsibility to assure that the
yeah,
unlicensed does not function autonomously?
Yeah, I mean, we could really put that under B. The supervising OT shall at all times be responsible for all services provided by unlicensed personnel or volunteers and assure that the unlicensed personnel do not function autonomously.
yep, yep.
I think the reason you had it two different things was because you're saying the OT is responsible for it as they are with anything, but you're saying that the OTA is still, like if they're in charge of that client, then they're still there with them. Like, to me, it is kind of two different things.
Well, because you say OT in the first one and practitioner in the second one. That's
Right.
what I was saying.
Yeah,
Oh, I see. Okay.
yeah.
So you could combine them and just put the supervising OT practitioner, because an OT assistant can also supervise a volunteer or an aide, right?
Yeah, it should be OTP.
Yeah.
So just,
I don't
yeah,
I don't think it should be separate because they could both.
Well, there's a difference in being able to supervise them and being ultimately responsible for.
Okay, you're right.
The OT is ultimately responsible, but what can the unlicensed personnel do? Because that's always been a confusing thing to me. I know they cannot provide skilled services, but there are things, unskilled things that they can do without direct supervision, right?
Not, it needs to be within line of sight, even if they're unless it's just something like cleaning up a space, then they
Or like
obviously.
they can set up like the equipment, like if you're doing I can't think of the thing, the pressure garment for swelling, that you put I'm talking about like, I'm thinking when I go to PT, like they set up the thing for like that I put on, and then they start where it pumps for swelling. Like they can set up equipment where the PT says, it's at this setting for 10 minutes.
right.
Something like that. Like I know they use them in OT too. Like they can set up stuff.
Kelly's bringing up a good point though, that maybe we should be more specific about when we're expecting the tech to be under direct supervision. We're really meaning when they're interacting in any way with a client. They don't have to be under visual inspection of the OT to clean up an area or to set up an area. But we're saying that that if they're doing anything that we're going to bill for, and then it needs to be direct supervision in which we're actually can watch what they're doing.
But I think the thing that she just said is not what B is saying, because it's saying that they're responsible for services provided. If they're not able to provide a service like OT intervention, it's exactly what she's saying. It gets back to then what can they do? Can they provide a service, mean an OT service? Like B is a little like when it says all services provided.
I mean, in that rehab, techs do stuff. They
Right.
go and you don't have direct visual supervision. I mean, a rehab tech will go and help somebody needs to go to the bathroom. The rehab tech will take it, and that's part of OT. The rehab tech will take
Right.
them and do transfers in the bathroom so they can go to the bathroom. So I think direct visual supervision, or they help with ADLs in the morning.
I have a problem with that.
They do.
I know they do it, but that's what needs to like be cut out. Like
Right,
this
they're
wants to be
we can't-
tighter.
we can't bill for that. They could do it, but we can't bill for it. But I know we're
But
not
they-
doing the billing here.
They are
Right.
billing for it. That's why I want like us to
So
have.
should we say something like that? Should we say like, or, you know, they are not able to provide a service, a billable service that is not within the line of sight or with under direct supervision, or how we define that? I mean, maybe we need to put that here, that if they do it, we can't bill for it. Like a billable service, if it's not in, I mean, I think, you know, like Amy said, they're doing it, so this could open up a can of like craziness, but if this is what we're saying that we don't want them to do, then we need to put it in here that they can do it, but they can't bill for it. I mean,
You know, or if they're in a room and they're just gonna go put a hot pack on somebody, they billing for that, but I don't have direct line, I may not have direct line of sight because they're in a separate room doing that.
right, or like the OT walks out and, you know, they're monitoring their exercise and counting their reps, but we're billing for that exercise.
Right.
That would be an example where in general, I mean, obviously, if the OT needs to step out to go to the bathroom, they're gonna go to the bathroom. But in general, if you've set up the tech with a patient to do some exercise, the OT needs to be around.
Yeah, but that's the thing is
Around is different than vision.
What's
Direct line of
around?
sight is
Within visual, I mean, within vision, within vision,
You
they
know,
need to be in the room.
I know that AOTA defines what they should be able to do and define skilled versus non-skilled, and then they define non-skilled, like set up things that don't require any kind of judgment or interpretation or grading or anything like that. So
that's
we
probably
could-
the route we need to go. I mean, because we
Yeah.
talk about it here in E, that direct supervision is required at all times, a visual range of the client, and immediate physical intervention video, you know. So maybe we need to divide this into like skilled versus non-skilled.
But we really don't want to put the word skilled with an unlicensed tech.
Right,
I'm not crazy
Well, it
about.
always needs to be unskilled,
right.
that
Right.
they cannot provide skills.
Exactly. That's why I wouldn't mind if it was direct supervision is required for at all times when the unlicensed personnel is interacting with a client. That does leave open other things they can be doing that does not require line of sight. Setup, breakdown, cleaning, copying, making schedules.
Transport.
Transport there's lots, but that the direct supervision, meaning line of sight, is required anytime they're actually interacting with a client.
But transport's considered interacting with them.
Well, we could also, you can't bill for transport. So
Right.
some of this does a little bit come down to billable services. I just don't know if we want to.
So what if just like somewhere closer to like 8.5, something about like unlicensed personnel or volunteers can only be delegated unskilled tasks. And that's, I mean, that's not the best words, but something
Right.
along those lines.
And then we just have to define unskilled as a non-billable activity or service. Delegated to perform non-skilled tasks or to assist with or
Perform.
Yeah, because it's not always assisting. They sometimes do things
Right.
independently.
Yeah, because I mean, if the unskilled, if the aide or the volunteer is going to be of any help to me, I want to be able to give them the whole task to go do, but it just has to be.
so like just playing devil's advocate, going back to what Amy said, would like applying a heat pack or a cold pack be considered a non-skilled task?
Yes,
Yes, probably.
it's, as long as there's a definition and I can't find it. It doesn't require any kind of like interpretation, like things aren't going to change. It's something that they've done before. It's a routine. It's,
Did that come from AOTA, Kelly? Is that what you're saying?
yes. God, I can't.
I don't know, when you add the interacting with client, then that would take out like transport and trying to think of other instances.
Or just if it's group and they're, following them to do different exercises on different machines. And the tech does that, but you may be in another part of the gym or not have the direct line of sight makes me think that's not possible. Or not possible, it's not going to always happen. You're not going to always have direct line of sights. Especially when they doing other things or if they're helping with something, I don't know.
So if we don't have when interacting with them, but the visual thing, if we consider like putting, like if part of their exercise is doing like 10 reps on this machine and 10 reps on that machine, if the unlicensed person brings the patient from one piece of equipment to the other, but is not changing what they're doing. In other words, like they're not saying, oh, now you can do 20, or then that would be considered non-skilled, that they wouldn't have to be in line of sight. So that would be considered a non-skilled task. But when she includes interacting with the client, then no, that wouldn't be able to be done.
I found AOTA. Can I share the screen with this?
Sure. Make sure you save that though.
Are y'all seeing?
Yep.
Does it look very small?
Well, the first one was better and then it switched, but
Yeah, I know. I see what I did something. I screwed something up, and now it won't let me like. Hold on. Okay, is it large?
Yeah, that's better.
Okay. So here's supervision of OTAs as per AOTA
What year is this from? You know?
2020. Aides do not provide skilled OT. An aide is trained by an OT or OTA to perform specifically delegated tasks. The OT is responsible.
Non-client related, that's what I was looking for.
An aide,
Non-client, yes.
what's that?
The non-client related task. Yeah.
Client-related tasks are routine, which may aid.
And the
I
word
like some of this
predictable.
wording for sure. Like that the environment's stable and would not require judgment, interpretation, or adaptations. I think that's super important.
So honestly, we could again refer to AOTA guidelines
Supervision, yeah.
on the supervision of occupational therapy aides.
Is this in the supervision document or the practice, standards of practice document?
This is an AJOT. And what is this thing?
Guidelines for supervision.
Yeah, guidelines for supervision. Okay. All right, so where were we at here? Delegating, okay, trained.
So do I want to put some of this in here or just refer to this document? I think we should probably put some of the language in there.
It does talk about that they can't be used to perform billable functions. It's another way of really covering a lot of stuff and actually making it very clear to the OTs of Louisiana.
I think we need to put this in there. I think referring them to the document's good too, but in case they can't find it or too lazy to do it, at least it spells out some of this, some of it. I don't think we need all of it, but definitely
I don't-
something like,
If they're not members, I don't know if they can access that.
right,
That's a good point too.
yeah.
So client related versus non-client related
Yeah.
tasks.
Mhm.
I think you highlight, I think we take 3 and 4.
I'm just gonna highlight a lot with then we
Yeah.
can.
Yeah.
Go down.
You got the picture too. Yeah, there you go.
Well, we thought this was gonna be the fast one, huh?
It's always been a difficult subject for me to explain because I really don't know. I don't know how to explain how they're utilized. I don't know, because you can't bill for it, so I'm not real sure what the purpose is.
The best utilization of a tech is for setup, cleanup, transportation, assisting you with your clients that require more than one person to safely ambulate, stand, or transfer.
But like,
To supervise routine after you have set up the task and explained exactly what you want, and it's going to be a routine task.
so then you can bill when you're.
But you've got to watch
set
what
it
they're
up.
doing. You got to be there.
Yeah. Okay, that's what I was
Yeah.
wondering, because it sounds confusing. Because I haven't used text a lot, but it does sound confusing if you can't bill for it, but you've set them up and then they're there with them
Yeah,
for 15 minutes. Can you bill the 15 minutes?
If
no, you can't. Well, I mean, if they're in direct line of sight and they're just assisting doing the exercise program.
if you're in the room
Okay.
and you've set it up and the tech is there to like count the reps and keep them company and make sure they're safe, and you're providing direct supervision, then you can bill for that.
Yeah. Yeah. No, it's, and like Amy said, like some people are doing a little more than they should be, but I think here, if we just kind of make it like this client related, non-client related, and the billable thing, I think that kind of takes care of all the interpretation, because it really makes you think about like, well, if I'm billing for that, but I'm not in the room, then they wouldn't be able to do it. You need to change like in H4 would be occupational therapy practitioner delegates instead of OT and OT assistant.
Mhm.
And it says to the aide, would it be aide and or volunteer?
Well, and we're choosing to use the term unlicensed personnel, so
Yeah,
I think we ought to stick with that personally.
And then that, just the unlicensed personnel helps it. And I know like OT is fading out of mental health, but I know years ago I had issues with like I could have shown this to my employer and in my defense of them saying, well, why can't you just hire minimum wage employees and you just sign off on all of it? It all looks the same to me. If you do a craft and they do a craft, why can't it just happen that way?
yeah. So should that say unlicensed personnel and volunteer?
Okay. This part, we can keep it if you all think we should, or that this is where I would wonder if we could reference.
I think put it, honestly, I just think
Okay.
it prevents people from like saying they were gonna go look, but not, and it just protects the consumer more, you know. And then also F, we have unlicensed personnel, but we don't mention volunteer too, so I don't know if we need to do that.
On where?
F, direct supervision is required for all unlicensed personnel and volunteers.
Okay.
I mean, I don't know how Kelly feels, but I feel so much more comfortable with that in there, with just the whole really laying it out. It's just so much less ambiguous. So
Do we have the definition of direct in here?
No, we're gonna have to add, again, like, we're gonna have to go back through the whole document and create a whole, the definitions have to come last.
Okay, so what is the definition?
it's right there.
Well, we do have it right here, but we're gonna be adding
That is
that
the definition.
definition section.
So does it mean that they can be working with another client?
Say it again, Kelly.
Does it mean that the OT or OTA can be working with another client while they're in direct line of sight with the?
Yep,
Yes.
it's there right there. Mhm.
Yeah, it would mean that,
Okay.
yeah. I don't think we
Okay.
ought to be that specific, though. I really don't. I mean, we do have to keep things.
Well, some of the supervision definitions do say that, like they have to be not
Yeah.
doing anything else sometimes.
I know, I question that a lot when I'm in, you know, a regular customer of physical therapy, and like the PT's with me literally 15 minutes and I'm with the techs like the rest of the 45 minutes, and they're seeing other patients, and I'm like, this is how they're making so much money, because it's like double dipping almost, like he's billing for multiple people at multiple times.
I actually questioned that once or twice when I personally was having OT
Yeah.
for hand therapy recently. You know, most of what unlicensed people were doing, I felt comfortable with, but a couple of things I was like, I really want the OT to look like this isn't feeling right
Right.
to me. I really want the OT to come look.
Mhm.
Yeah. So what about J? I need to read J. The supervision of the unlicensed personnel or volunteer needs to be documented. For example, orientation checklist, performance review, skills checklist, and service participation. Documentation includes information about the frequency and method of supervision used, and the content of supervision, and the names and credentials of all persons participating in the supervisory process. Y'all okay? That
I mean, that's basically just saying that with the skills checklist, whoever checked them off, their name needs to be on it.
Yeah.
But I
It's like
guess
a
it also talks
competency.
about method of supervision.
Is this like, are we saying that there needs to be a service competency form for the unlicensed personnel?
well,
Yeah.
it doesn't.
I actually feel like this is two different things. Because the first sentence is about a service competency. and having that documented. The second part is more about like documentation includes information about the frequency and method of supervision, the content of supervision. Where are they talking about that that's going to happen?
I don't
Right.
know. That's
Not
my
on every
question.
note, every time
Uh-huh.
an aide helps or somebody, do you need to document that where on every single note?
Why and why? I don't even think that's necessary.
Just take out the last sentence.
Yeah.
And I don't, is supervision the right word?
No, I think like this, the skills, competence.
Yeah.
I think that's better.
I don't even like in-service participation because
Yeah,
that doesn't require any kind of
One more space. There you go.
show back, or what do you call it?
Much better. Everybody okay with that?
We can
under
start.
the part about like the supervision needing the documentation, is that more aimed at like when they're doing something with a client?
No, they're just saying that the competence for them to do that there.
I guess I'm just thinking like I have volunteers come in and they come in once a week to go staple papers for me. Do I have to have?
Not a billable service. Nope.
Okay.
So for all client related tasks,
Yeah.
Yeah.
That sounds so contradictory to me. Because we just said they can't do. I don't know. I mean, if we just take it straight from the roles and responsibilities from AOTA guidelines, it just says the supervision of the aide needs to be documented. Documentation includes information about frequency and methods of supervision used, the content of supervision, and the names and credentials of all persons participating in the process.
but that would mean
But you
every
wouldn't-
progress note would need to include all of that. But we've already just established that in Louisiana, we've already stated what kind of supervision is going to be provided. That for all client related tasks, direct supervision has to have been provided.
And so then
then
is that where it should say and documented?
It just sounds contradictory to me.
Why does it sound contradictory? Because at first you said, we just said they can't do it, but this is all the things that they can do. And then that last thing's just saying that it has to be documented that they're competent in it.
Okay.
Like, tell us what makes you feel like it sounds contradictory, because that's important.
Okay. Maybe I need to read it all again. So are you, is there a way to make it bigger to see the whole thing, or?
Smaller, so you can see the whole document at the same time. That didn't go so well. I hate it when it decides to do 2 pages like that.
Based on size.
See, it goes into 2 pieces of paper, and I don't know how to stop that, but then again, maybe you can see the whole thing now.
I think you have to go to view. And
You see
one
at the
page,
bottom,
you see
What-
one page where it says Zoom 100%. Yeah,
Oh.
and then
or at the bottom there, it looks like a book or just a page.
Yeah, but that's actually worse.
Well, then you're gonna have to adjust the size at the bottom of your screen.
Yeah.
Yeah, we just, we were better off when I guess we had it in 2 pieces of paper.
Well,
But
go to the bottom of your screen and click the little book.
there we go.
Ingrid, this is my ADD jumping in. We never did, can you make a note that we didn't put anything about the assistants being able to do PAMs?
Yeah, when I have it in this view, it won't let me write anything.
Okay, well, just help me to remember, like we were supposed to do that. I don't know why.
What, that we never did what with Pam's?
Put that the assistants can do it. We said we were gonna put it somewhere in the supervisory part.
Okay.
Sorry, I don't know why my brain just remembered that. All right, do we have any other questions or edits on this section?
I'm just looking at D and that we would revise this to unlicensed personnel and
And volunteers, yeah.
volunteers, yeah. For
That's what
D.
made me do it. When I saw it, I think that's what reminded me about the PAM.
And then in
Okay, so you,
E, does it also have to say and volunteers?
Yeah, it does. I can't fix it until I get out of this view.
so are you saying to add for J, the competence of the unlicensed personnel or volunteer needs to be documented when performing client-related tasks? Is that what you were saying to do?
I did already add that. I don't know how it disappeared. That's so weird.
Okay.
You can make it smaller and fix it.
Yeah. Okay.
And we are going to identify skilled versus non-skilled, or is it in there?
Well, we have non-skilled tasks.
We have skilled, and then we have client and non-client.
And well, E has non-skilled, so I think we're gonna have to, at least in the definitions, put definition of skilled and non-skilled tasks.
Yeah, okay, that would be.
Yeah, but I'll highlight, I'll italicize that. This obviously needs to be defined in the definitions. Client related, there's what we've defined. And what was I about, oh, down here, when delegating.
So J,
Need to be, the competence needs to be documented for all client related tasks, right?
yeah.
I could swear I'd already written that.
I'm pretty sure we watched you type it.
Maybe you hit undo at some magical moment, set a save.
Oops, I was trying to make it so everyone could see it, both pages again, but it's got its own mind here.
I think that's better. Yeah, looks good. You want to do the students very quickly, and then we can take a quick break.
Yeah. So I had kept it simple with the supervision of the students, just basically referring to AOTA guidelines. OT and OTA students completing their clinical education will be supervised as per current AOTA guidelines and position papers. Documentation by OT or OTA students must be co-signed by the supervising OTP. So it's very short.
I know, but I like that it's separate too. You know what I mean? Like, it's very like, okay, if I'm looking for this in the rules, it's there, and then it tells you where to go to. So I think it's fine. Yeah. And I think just leave the question marks for those sections because we'll figure that out when we pop it in.
Okay.
And then that reminds us of that. So do y'all want to take a vote on these two sections? And then we can pop in the Pam's thing, figure out where that goes so that they know that an assistant can do those. So we'll vote on this first. Is the unlicensed. I'll make a motion to accept the supervision of unlicensed personnel and volunteers and the student sections.
You know, with the student section, a lot of that, when you go to AOTA, I think, is about, they kind of defer to third parties. Like, I know we're not going to get into billable and Medicare and all that, but that's where most of the information about student responsibilities are found.
There's a position paper from the AOTA, and that is definitely one that we should have a specific in our definitions when we define things.
Okay.
That gets into when you use line of sight, when you don't use line of sight, all the different factors you take into consideration for supervising a student that they expect.
Okay.
Okay, I motion to accept these two sections as written.
A second.
Brenda seconded.
Okay.
Okay.
Want to take the vote, Darby?
Yeah. All in favor?
Aye.
Opposed? Abstain? And any public comment?
No.
Thank you. All right, so we can get rid of that and
Okay, what do you want me to share screen with next?
I was just gonna go find in the rules where we can put that the assistants can do PAMs and then we can take a quick break. I just don't want to forget that, and it's not something we can do without a vote. So that would be, I'm guessing, in the supervision part, right? That's 4925, that's on page 20 in the rules, somewhere in here.
You're sure that wouldn't go more in the somewhere with the definition?
I mean, that makes sense. Just to include something about that,
Where did we put the definition? Page 1, the physical.
yeah. But we didn't put a definition, yeah, page 1.
Okay, it means there's, okay, yeah, no, that's not having anything to do with OTAs.
But in the,
That's got
but
nothing to
in
do.
in the OT definition.
That's what it
could
was.
you-
That's what I was thinking, the OT
Yeah.
definition.
Right, and then you could just say, you could add OTP in that part. And that would include all the intervention types.
And the OT definition was on page, was that the one that was further along?
Although y'all remember that we put dry needling as a PAM, and so that would be a broad statement to say they could do PAM, but what they can't do dry needling.
Good point.
Yay,
Right.
Kelly.
I mean, I guess you could say with the exception of, but
What's in the dry, didn't we put that in the dry needling, that OT assistants cannot do it?
Correct.
I
That
believe
was
so,
Kelly's point.
but if we say it there, it just sounds like,
Right,
oh, I'm gonna
no,
read
you're
it
right.
here that I can, and then they won't keep going.
Okay, it also doesn't feel like in this definition of OT that this is the place where we mention about OTAs being able
I
to
think
do it.
it's gonna go somewhere in the,
And we have a definition of an OTA right here. A practitioner who is licensed to deliver OT services in the practice of OT under the supervision of and in partnership with an OT licensed under this chapter.
You could say there that they could perform all intervention types as outlined in the OT definition with the exception of dry needling.
Could you repeat that, Kelly?
Oh, that if you could say that that they can, under the supervision of an OT, perform all OT intervention types as outlined in the OT definition with the exception of dry needling, or unless you want to wait until the supervision section, I don't know.
They may perform all interventions defined where?
And the OT definition and the occupational therapy definition in green, that part we just
Okay.
added,
All right.
all interventions defined in the definition of occupational therapy under the supervision of an OT with the exception of dry needling. If that is in fact correct, I believe it is.
Would the under the supervision phrase work better as the start of that sentence? Under the supervision of an occupational therapist, they may perform all interventions defined in the definition of OT with the
Yes.
exception of dry needling.
yes, to start that sentence with under the supervision of an OT.
They may perform all interventions.
There you go.
Should we say including physical agent modalities? They may perform all interventions defined in the definition of occupational therapy, comma, including physical agent modalities with the exception of dry needling.
That would probably clarify why we suddenly said they can't do dry
Yes.
needling.
Because all of a sudden it's like, oh, they can do everything except dry needling.
And instead of they, can we put occupational therapy assistant? Because we don't
Yeah.
really see they anywhere, do we?
Right, yeah. Yeah. Should we say something about we like under the I don't know the word here, it's not designated, but under the link like designated amount of supervision, they can perform all interventions. Because we don't really say what type of supervision, but like, we don't want to say it's a general because it may not be general under the not agreed upon.
Appropriate?
Yes, yeah. Do you see what I'm saying? So it's not like, well, they don't say what kind of supervision, but like it's defined later, basically, like based on. Yeah, I feel better about that.
Mhm. I like that.
Yeah. All right. OTA definition, motion to approve.
And why are we pluralizing? Why are we assistants instead of an assistant?
Wait, where?
In the green, under the appropriate level of supervision, occupational therapy assistants. Why are we making it plural there?
Oh, yeah, it shouldn't be.
Should be an occupational therapy assistant.
Yeah.
Good catch.
In the definition, I can reading this one. Okay. We have a motion to approve the definition.
I'll motion to approve it.
Amy. Someone to
I'll
second.
second.
Who was that? Carolyn?
Kelly,
Kelly, sorry.
I'll have my work computer back next time.
No, it's fine. It's just, it usually lights up, but you weren't in the list. I made it small. It's my error, sorry. Okay, all right. We have about an hour left. We'll take a 5-minute break.
Wait, we didn't vote.
You didn't vote
Oh, I'm
yet.
sorry. All in favor? Thank you.
Aye.
Amy.
Aye.
Opposed? Abstain? And public comment.
No public comments.
Thank you. Thank you, Amy. Keep me on track, girl. I just need to run to the restroom, honestly. Okay, so let's take, it's 12:08, like 5 minutes. We'll come back and we can tackle telehealth. All
Sounds
right,
good.
see you at 12:13. Brenda, I don't know what light you have, but it's like the perfect light for you. Like you always look so well lit.
It took me a long time to figure it out. And it was like, it works really well if the sun's out, but thank you.
Well, I was like, she looks so bright. Like if I put my other light on, it's like super bright, but that's how I really like to work, but it's too bright for the
Yeah,
camera.
yeah, I have difficulty, as we're going into the telehealth section. I see some kids via telehealth and they like, I can never get the lights right. And they'll say things like you have the wrong glow on your head today. I'm like, I don't know how to fix it.
Yeah, that's hard.
Yeah. And just in case you might think that you're having a bad day sometime soon, some people in Montana just got attacked by otters floating down the river. So
Nice.
random fun fact. I was just checking my emails.
Great. What next?
Yeah, weren't people just attacked by seals also like 2 weeks ago in California?
Oh, that's right. Yeah, I did hear that one. So, I mean,
What is this world coming to?
Otters is worse because they're cute and you think they're gonna be sweet.
They're cute, yeah. So
Yeah, when we were in Costa Rica, we like pretty much got attacked by monkeys that you would think are super cute, but they're out in the wild.
yeah.
Okay, what do you want me to share the screen with something else?
Yeah, I would say open up the document that says LA proposed telehealth rules. And if people want like the OT, I think it's called Occupational Therapy and Telehealth, that document I sent to everybody and it's on the cloud share, but basically I cut and pasted everything from there and I tried to reference it all. Felt like I was in school again, working on my thesis. It was really what all of this has been like, okay. Put the view bigger. All right, so basically what I tried to do, hopefully y'all had a few minutes to read this before today, but I did like, I put one and then I put or, and then I put or. So I started with the Louisiana Telehealth Access Act for the definition because I felt like that would probably be the most appropriate for us to review so we know what Louisiana's act. Y'all know that that just went through. So that's, I figured a good starting point. So it's the mode of delivering healthcare services that utilizes information and communication technologies to enable the diagnosis, consultation, treatment, education, care management, and self-management of patients at a distance from healthcare providers. Telehealth allows services to be accessed when providers are in a distant site and patients are in their originating site. Telehealth facilitates patient management and caregiver support for patients and includes synchronous interactions and asynchronous store and forward transfers. So other options are the next two. One's from North Dakota and one's from Mississippi. Kind of like the other ones too, but I feel like we need to stick with Louisiana. Yeah, I'm gonna read those.
I do think I'll stick with Louisiana too.
I think we also should stick with Louisiana. And I guess the only thing that concerns me of having it in the OT part is the part about diagnosis. Like,
Yeah.
do we just leave that word out and everything else fits?
Mm-hmm. And I don't know if y'all read your email this morning, if y'all saw the alert, or it wasn't an alert, but it was the thing from the board. Did y'all see that? So one of the things in there was two things that are relevant to us today. Let me see if I can pull it up real quick. But one of them said that they made a motion to not use the word telemedicine, and they switched it to telehealth.
Wow. I am
Yeah.
surprised by that. Dr. Van used to be super clear about that distinction. He used to go, he goes, wow, I'm surprised by that.
Yeah, okay, so it's, I'll just read it to you. It's Senate Bill 66, Act 322. It was sponsored by Senator Fred Mills. It requires the change of the term telemedicine to telehealth and removes requirement for an in-person visit to establish patient-doctor relationship. And that'll come up later with the patient-doctor relationship. But I just thought y'all should be aware of that.
Yeah.
Okay, so I guess we can get rid of the other two. Because I'd kind of done, when I did this, it was before our act went through, so.
I'll just save this as a, let me just save it as a, with a new date.
Okay. Or you can take the DP out. Yeah, DP just means that I either edited it or it's my version. Just so I know. Okay, so number 2, in order to provide occupational services via telehealth to a client in Louisiana, the OT, and I guess it should be OTP, must have a valid and current license issued by the State Board of Medical Examiners. Louisiana licensed OTP using telehealth technology with a client in another state, even if the client is a Louisiana resident, is required to be licensed in the state in which the client receives those services and must adhere to those state licensure laws. So that's saying, this is what happened to me over COVID. Kids that I see that live in Louisiana went to their Mississippi house, went to their whatever house, went to their Tennessee house. I could not see them because I'd have to be licensed in those states and follow those licensure laws. I just want to try to make that very clear that that's what we mean by that. And that's also in Wyoming, North Carolina, and Oklahoma, just for reference. Number 3, when providing occupational therapy services via telehealth, an OT shall or OTP shall determine whether an in-person evaluation. So this really isn't applicable because of the thing that I just read. So remember the thing I just read you from the State Board of Medical Examiners saying that you don't have to do the in-person to establish the relationship. Now we can keep it for OTs because that's like specific to a doctor relationship, but I feel like if the doctors don't have to do it, are we going to say that we have to?
Well, the thing to keep in mind about that is all they did was remove it as a mandatory element. It still is directed to the standard of care and the individual practitioner, whether or not good practice, good medicine requires that in the judgment of the individual practitioner. So it just made it no longer a legal mandatory requirement that you have to do it. Just because you don't have to doesn't mean there aren't circumstances when you should.
Good point. Yeah. And this is specifically for the evaluation.
And I mean, I like having that it does not have to be, because I think and it depends on what you're evaluating.
Right.
You know, if you're simply looking at, you know, let's say a student in the school system who's just having issues with handwriting, that's different than even in that same school system, you get referred a student who what they really need is wheelchair positioning.
Right.
I'm not that good. I
Right.
can't provide across state lines. I can't provide wheelchair positioning without hands-on. But
So
some
this
other
kind of
kinds
leaves it
of
open.
assessment can be done.
Yeah. So it's just saying that OT, and we would leave it at OT because it would be an evaluation is necessary.
But then where is the part about that it's also necessary for the OTP to make a judgment about whether the best intervention type would be in person or that it's not?
I think that's in here.
That can come later.
Yeah, I think so. If not,
Okay.
just keep that in
Then
the
we'll
back of
leave
your
that
mind.
alone. So we're just still on eval.
Yeah. All right, so that's just like for the eval. So like you would kind of determine whether you need to do an in-person one or if you could do it by telehealth.
Okay.
And then this is like prior to, so there's a lot of language in a lot of states about like the prior to. So the OT would determine whether an in-person eval is necessary and make every effort to ensure. So if we keep this, then we can probably take out like 3 because it's kind of saying the same thing. Or we could say the OT must have contact with the client during the evaluation. The contact must be synchronous audio and synchronous visual. That is in person via telehealth or via a combination of in-person contact and telehealth. Other telecommunications or information technology may be used to aid in the evaluation, but may not be the primary thing. So that would be like phone calls to get the, information. So it's kind of an either or, but I mean, A is kind of saying the same thing as 3. But it's just whether we want it to be in the section that says prior to.
Oh, I see what you're saying.
So like some states broke it down to like prior to performing, like you do all this. And then some don't have any of the prior to. So like if we took it all out, I still wanted to leave 3. But if we don't take it out, we may leave it as like the A and then have a B and then later.
Okay. Well, no, I'm just trying to think of, I'm also licensed in New Mexico and I see patients there and trying to think about like sometimes before I actually sign on for the evaluation, I don't have enough information to know if I'm going to say, yes, I'm going to continue with this evaluation, or I'm sorry, like we have to not do this.
Right.
I like the way it's worded in 4B, that's either during, before or during the provision of services.
Yeah.
There might be some things that come up, you're like, oh, we can't do it.
Yeah.
So I don't know where we would want to work that in, but.
I mean, I kind of like having it divided to like prior, because like once we go to B, like it says, if they determine before or during the services can't be provided through telehealth that's consistent with in-person standard of care, the OT shall not provide or supervise services through telehealth, and making the determination of whether services should be performed in person via telehealth, the OT shall consider at a minimum. So then you would not do the ors, and then it would be that little like 1, 2, 3 at the bottom. So this is the things that you would consider. Ingrid, you're gonna have to move it up for us, please. That so this is saying either before or during you're doing the services, whether or not it needs to be in person, and making that determination, you would consider at the minimum the complexity of the condition, his or her knowledge, skills, context and environment, nature and complexity of the intervention, pragmatic requirements of the practice setting, and the capacity and quality of the technical interface.
Oh, I do like that.
I like that because all of those are important.
Right. So the or part was an OT shall determine whether an in-person eval or in-person interventions are necessary, considering those from California, or you could say the OT determine whether in-person are necessary, make every attempt to. It's all kind of saying the same thing. It's just semantics. It's just kind of gave you options. So if you keep the first one, then it just kind of, the beginning of the B was just a little bit wordier, but I feel like they all kind of say the same thing. I kind of like the first one better because it's just saying like if you can't, then you don't supervise it either. Like,
right. And it just kind of keeps it simple and straightforward too.
Yeah.
What do you mean by the first one? What are you talking about?
So B. So you have 3 options for the beginning of B. You see where there's like those big bolded ors. Those 3 things kind of say the same thing, but that very first one
Oh,
Like
yes,
saying
I
that if
do
it's
like that.
not consistent with the in-person care, then you can't do it. When you
Mhm.
can't supervise it. And I think of Dr. Van, because he's always saying like, if it's not consistent with,
Mhm.
and the same as an in-person standard of care, then it's not appropriate.
Yes, correct.
So if y'all agree, then after it has the Mississippi, you would just delete all that until you get to that list. Yeah. So those are the things that you would consider.
We're talking about intervention here, right? So this should all be OTP.
Yes, you're right. And there's another one right before, right, where
And-
Dal is underlined. Yeah, and one more.
Well, but then that makes the OTP shall at a minimum and the OTP shall at a minimum. So the second, like the last sentence before the little numbers can go away.
Yeah. That one.
Oh, yeah, sure enough.
Okay. And then,
So we got number 3 saying that prior, the OT has to make the determination about whether the in-person eval is necessary. So then we don't need A here, right?
Does the OTA determine that part where that says the OTP shall consider at a minimum? The OTA determines that?
If the OTP, if an OTA is providing intervention through telehealth, then the OTA would need to can take into consideration. Would there be a reason the OTA couldn't take into consideration all these things? The complexity of the intervention they plan on doing, the technological interface. You think that the OT should make that decision?
Well, it says in making the determination. So wouldn't that be the OT?
yeah, because it would be more like the eval, like the initial.
Well, we've got the eval covered here under number 3, and
I know,
we've
but
got that specifically just as an OT.
We were saying is if you leave 4A, then you would erase 3, because prior to doing the telehealth, it says 4A is they determine whether an in-person eval is necessary.
Okay.
I put them both in case we didn't keep that, but Brendan and they said like they like that part, so you would take out 3, right?
Okay.
Because it's covered in 4A. Except we just have to talk about the A where it says or, like y'all want to keep the combination. It's really not an or because it doesn't say the same thing, but
It's
it's like,
really about a whole other thing. Does our definition of telehealth say that it's visual?
nope.
Aha. Okay.
So do we want to keep the second statement of A?
It would really be like, it's separate, right? Can I just call it B?
Yeah, you can. Well, I'll have to format the rest. Yeah. If you delete and go back and erase the or and hit return, it should auto format it and change all the rest. No, like
Go back.
right there, and then
Uh-huh.
delete and put it.
Yes.
Yep. Now hit return. Oh, it didn't. I lied.
Well, probably because I had already messed it up. That's all right.
We'll format it later. So
And does it have to have visual the whole time? Because what happens if you lose it? You lose visual and you do a part of it if it's, I don't know.
it says
I know
or
hard to-
combination.
This is confusing.
Every time I reread it, I get lost. And then I think I
Yeah.
understand it, and then I read it again and I get lost again.
I think you can take out all of B. It's very confusing, and I don't want it to say that it's just. I mean, or I guess, do we want to make sure it's not just a telephone call to do the eval? You see what I'm saying? Like, that's kind
Yeah.
of what it's getting to. It's like, I
Well-
know it's saying that you have to have contact, but it doesn't have to be in person. Like, you at least have to put your eyes on them to, like,
So something about, because we're talking evaluation here, right? That the evaluation must include a visual component.
right, correct.
It just feels like this part that I just highlighted needs to go.
Yeah.
Yeah, that was one of the confusing parts.
So maybe we put the occupational therapist must have visual contact with the client during the evaluation.
I like that. And it doesn't even have to say like
Right.
entire, because to the point that
Right.
was just made, but you do have to have visual. And I know in working with students and families with telehealth, that's one of the things they're like, well, we're here for our eval. Do we have to turn on the camera? Well, how
Yeah,
can I possibly know that it's even you or what your skills are if you don't turn on the
Right.
camera?
Yeah. So this is saying that you have to have visual, and it has to be visual and audio at the same time. And then it says other telecommunications can be used to aid, but it can't be the primary. So we're okay with
Yes.
that.
Yeah.
All right, so then B, the second B, which should be C, would be before or during they determine whether or not telehealth is even appropriate. We already went through that, right?
Mhm.
All right, and then the next part would be Idaho. If you scroll up a little bit, I just kind of threw that in there, that evals and re-evals must be in person. So I think we're saying like we don't want to do that. Because that would, and I mean, that also kind of goes against the whole like compact thing.
Yeah,
Okay. All right, so this would be D if we keep it, just so you know, Ingrid. OT practitioner shall obtain informed consent of the delivery of service via telehealth from the patient/client prior to initiation of OT services via telehealth, and maintain documentation of the consent decree process and content in the patient or client's health record. That's Wyoming's way of saying it. Or prior to initiation of OT services, an OT practitioner shall obtain informed consent of the delivery of service via telehealth from the patient client. The consent must be verbal, written, or recorded, and must be documented in the patient or client's permanent health record. Basically, we have to pick between those two or do a combination of them. How do we want the consent is what it gets down to.
did this not get clarified in our Louisiana law?
I mean, I can't say that I read every page through and through. I kind of went through it. I can go back and look. I don't know.
Patricia, do you know?
Sorry, I blanked on what's the question?
That's okay.
Do we know if the Louisiana Telehealth Act has any provisions that we're going through under D for informed consent for the delivery of service? So in other words, this is saying like it can be verbal, written, or recorded, but like we weren't sure if the Louisiana.
I didn't recall that specificity, but while y'all continue to talk, I can pull up that law real quick.
Okay, thank you.
Yeah, of course.
So say it's not in the law, do we have a preference? Like if the consent, this is the first one's just saying like, we just have to get consent and put it in document it. The second one is saying like, it can be verbal, written, or recorded, but it still has to be documented. Do you have a preference?
I would rather be able to get verbal, like you would get onto the
Yeah,
call
like-
with the patient and then just say, you know,
Right.
Do you consent to do this therapy session over Zoom?
Yeah.
And they say yes, and then later when you write your note, you write in your note that they verbally consented to the session being conducted via Zoom.
Yeah, okay, so erase the beginning all the way up to the or, delete that. Okay. Y'all make this so easy.
Yeah,
All right, I'm not sure if it's 5. I think this is from New Jersey. This is a question of whether or not, okay, so this goes to that patient-provider relationship. Any OT who engages in telehealth shall ensure that a proper provider-patient relationship is established. The establishment of a proper provider relationship shall include but not be limited to. So a lot of states talked about this. It was very interesting because some states didn't at all, and then some of the states did. And then, so basically this is saying that to provide that relationship, you have to include but not be limited to identify the patient using at a minimum the patient's name, date of birth, phone number, and address. When properly identifying the patient, you additionally use the patient's assigned identification number, so security number, photo. I mean, it's getting like very detailed. Disclosing and validating the provider's identity and credentials, such as the provider's license, title, and if applicable, specialty and board certifications. 3, providing prior to initial contact with a patient in an initial encounter for the purpose of providing services to the patient with reviewing the medical history and any available records. I don't particularly think we need to be this detailed.
that sounds too detailed.
I mean, we don't really have to put anything about the provider-patient relationship. That's why that question mark's there next to number 5. But I just wanted you to know that some people had that minimum.
Number 5 through number 3 under 5 feels like we have already addressed that under our eval section where we talked about it's the OT's responsibility to review, appropriate paperwork. Then in the properly identifying the patient, that is interesting. Again, I'm wondering if our Louisiana Telehealth Act addressed that, because we obviously would not be the only ones who need to make sure that the patient we're treating through telehealth is the right one.
Right.
In the hospitals, inpatient settings, it's very clear that you're to use 2 forms of identification. In outpatient therapy, what's the deal these days? How are you making sure that your patient is who they say are, or that you're treating the right person in outpatients? Does anyone know? I'm asking, I don't know.
No. I don't know. The wristband still. So think about that, but if you scroll down, there's another option for this. So we don't have to like edit this one because this was a different one. This was Indiana.
Okay.
This was saying a practitioner who uses telehealth shall, if an action would otherwise be required in the provision of the same healthcare services, blah, 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 ensure that a proper relationship is established. They must obtain the patient's name and contact information and a verbal statement or other data from the patient identifying the patient's location, and to the extent reasonably possible, identify the requesting patient. Disclose the practitioner's name and license, certificate, or registration. Obtain informed consent. Obtain the medical history. We would have to take that out because we wouldn't be establishing the diagnosis. Discuss with the patient the diagnosis, the evidence of the diagnosis, the risk and benefits of various treatments, including when it's advisable to seek in-person care, create and maintain a medical record, and issue proper instruction for appropriate follow-up care. So
Just saying, use the same standard of care we're using inpatient or in person.
But I kind of feel like, when Ingrid said like, oh, well, we have that in the eval section, I kind of feel like some of this is worth re-mentioning in telehealth just to make sure that people are doing what they're supposed to be doing, as far as like not thinking, oh, it's telehealth, I don't really have to do any of that, which shouldn't be the mindset. But I kind of feel like, people are just like, oh yeah, I can see these patients via telehealth and I don't have to worry about all this other stuff.
Right.
But I'm open to y'all's thoughts. I tend to like this second one from Indiana better with a little tweaking.
I'm reading forward to Mississippi and the way they're just keeping it a little bit more open, just verify the identity of the patient
Yeah.
prior to the session.
Yeah.
I do like some of the other stuff they talk about.
Yeah, I mean, this is Mississippi's I like number B, obtain an alternative to contacting, arrange for them to have alternative means for them to contact you, provide contact, for emergency purposes. Because if they're alone and something happens and you witness something during telehealth, who are you going to contact in a case of an emergency? Like, I love that one. Use personal identifying information only, obtain written form consent. Yeah.
I like that one.
Yeah.
Is there
My
anything
only,
in the
I do
other-
like that one too. But written informed consent
Right.
might be hard for some people.
Well, I don't think that's appropriate. I mean, I think if it just says,
Just obtain informed consent.
well, we already have that above,
Yeah,
right?
we did already include that higher up somewhere.
Yeah, for the informed consent.
I just think we did.
So that there isn't anything specific to informed consent in the new telehealth law. It does require rulemaking to provide at a minimum. It says application of all laws regarding confidentiality of healthcare information, the patient's rights, the patient's medical information, et cetera, et cetera. And it is, as you all have reflected, that it really is supposed to be the level of standard of care, not falling below what it would be if they were in person. So you all can make the rule that you think is appropriate for consent and obtaining consent and documentation of consent, so long as it would be consistent with regular good medical practice and record keeping.
Okay, thank you.
You're welcome.
That's super helpful. All right, so Ingrid, that means you would erase 5, like keep the number, but erase the New Jersey one because we said that was too much. And then also Indiana, and we were going to go more in line with Mississippi. And right above that is the informed consent thing. So we can take out the, is it F? Yeah, because we definitely don't want it written.
I mean, if you can get it in writing, so much the better. But if there's some reason why it's infeasible or impractical or whatever, I mean, certainly for your own sake, I'm sure you would want some kind of documentation of it.
Well, I mean, we have up there verbal, written, or recorded.
Okay.
So that at least, as long as it's one of those.
Yeah. Yeah.
Okay. Whatever is feasible. Okay. Scroll down, please. The OTP providing services via telehealth must inform the patient concerning treatment methods and limitations using the platform. We already did informed consent. So this was more like the informed consent. This one has a potential breach of confidentiality and inadvertent access to protected health information, the potential of disruption of electronic communication, and videotape and recording. So I don't know if we want to include that in some of the above mentioned informed consent, but Mississippi's saying like that has to be part of the informed consent.
And Louisiana isn't including it in necessarily an informed consent, but it is requiring you to have rulemaking, making provisions for that.
Okay. So, I mean, Brenda, I guess for you to look at that and see like what.
Well, especially if you're going to videotape or record the session, that needs express written permission, because that's different than that's the same as if I'm gonna set up a video camera in my clinic and record our
Right.
session. So that needs
Yeah.
distinct,
Consent.
yeah.
But with the informed consent, we're not saying that the verbal has to be recorded, right? The verbal can just be.
Oh,
verbally-
the verbal we said would be documented in the patient's record.
Okay, but we can get it verbally, but it doesn't have to be recorded.
Right.
So
But
what
then,
we're saying is like, it can
What Brenda's
verbally to
saying, if we
consent to
want-
treatment, but it's
Right.
written if you're gonna record it.
Yeah, I was just going back. I couldn't
Okay, yeah.
interject in time.
One while Kelly's going back to that other informed consent, I just keep thinking back to like working in the hospital and always having to like get on the phone with a nurse and be the witness to someone on the other end giving verbal consent. I just don't know how tricky verbal consent gets. And
I think an unwitnessed verbal consent is going to be not very useful.
So that's why I was wondering if that verbal needed to be recorded or something added to it.
Recorded or witnessed or something.
Okay, so it could say,
must be written or recorded.
well, verbal and then in parentheses
or verbal
and witness,
and witnessed.
so that if you do get verbal, it's witnessed, because. And then I guess you would document like who witnessed it and their names or whatever, and then written would be optimal, and then recorded.
I would. And I guess I don't know if recorded means like electronically recording or like I'm not sure what
I think
recorded
recorded
means.
means literally taking a picture or an audio recording as opposed to documenting, which would be putting it in the, writing it in the record.
Gotcha.
Is how I, as a layperson, I interpret it. It may be,
Recording, I do too. Recording to me means that you start a Zoom recording while they give the consent, then
Yeah.
you stop the Zoom recording after they've given the consent to treat over telehealth.
Ah,
So we could just say verbal, witnessed or recorded.
We said, I changed it to be consent may be either verbal and witnessed, written, or recorded.
But it can't
And-
be recorded if it's not verbal.
Hmm.
It can't be,
It's
so,
either, well, verbal and witnessed would mean it's not recorded.
but you can't, but the recorded is verbal.
That's correct.
So that's why I was saying. could it just
Okay,
say
so it's
verbal?
either verbal and witnessed, comma, verbal and recorded, comma, or written.
Or just verbal and then in parentheses, witnessed or recorded.
Got
Yeah.
it?
yeah.
I got better. Witnessed or recorded. Or written. The consent may be either verbal, witness, or recorded, or written. And must be documented in the client's permanent medical record.
Yeah. Okay.
And then do we
Oh.
want, in this same section, I guess, is where we ought to talk about what the therapist has to inform them of the limitations, huh?
Yeah, so I think like that part where it says A and B, if we keep all that, would just go under the section above. It wouldn't be separate because
Right.
it's really still part of initial contact.
Yeah,
You know, like you're still telling them that like, hey, we may lose connection. What do we do? And that, you know,
You
And
have
then
to get that every session.
no, I think it's just at the beginning.
Okay.
Thank you. Did you put it in the right place? I was thinking it goes under that last.
Although it doesn't hurt to have a little 2-second script at the beginning of every telehealth interaction that says, as a reminder, if blah, blah, blah.
Yeah.
Mhm.
For sure.
And I'm trying to find it. Do we have a place where we're asking their location? Where if there's an emergency, we can call 911?
Yeah,
Or-
so it says, wait, I hope we didn't take that out, but we like that. I'm looking to see where it was in the
I
original.
thought I saw it, but then I'm not.
Yeah.
It was under the Mississippi one where it says verify.
Well,
Yeah.
and it may have, there's like two different things you're wanting to know when you're asking about location. One, I want to know that you really still are in New Mexico today and you haven't gone to Arkansas or Pakistan. And then the other is where, so if you are still in New Mexico, are you still at home? Are you at the same number I always call you at? So if something happens and I need to get your mom on the phone, do I have that information for today?
Scroll down, Ingrid, I think we, right there is where it's, no, that's not it. I think we, no, that is it. Right there, D, provide contact methods of alternative communication for emergency purposes. We're just gonna have to like clean it all up. Now that I know like what y'all want, like we can, it's redundant here, but like I can clean that up. But yeah, that we kept that part. So,
I was just trying to put what we wanted here. Like this is all part of informed consent, right?
kind of like
RTP
prior
must
to ish.
inform-
Yeah.
Yes, inform the client
Where are you going with this?
of the following.
Oh,
The limitations of treatment using telehealth,
yeah,
the potential breach of confidentiality, and the potential disruption,
right.
like that.
Yeah,
I'll put it together and then y'all can see if you think it looks right.
yeah.
I don't know if you want to refer to the code of ethics in this, but it would be a good time about him, because that's part of the code of ethics of informed consent.
Yeah, I'll clean all that up, Ingrid. Let's see, because we're,
I'm just trying to see if the way it's written is working for everybody. I really want to just do it like that. Okay. So within informed consent, what does the OTP have to inform them of? The limitations of treatment using telehealth, potential for the breach of confidentiality, the potential disruption of electronic communication, and then this feels separate almost. Like this videotaping or recording of treatment session needs to be up here. Should the therapist want to videotape or record the treatment session, written consent must be obtained.
just take it out of the bullets and we'll put it
Yeah.
as its own thing. Yeah. Okay. All right, so that would be what they have to inform.
So I did not include this one, use of electronic communications in the provision of OT. I feel like I don't understand what
No.
that means.
No.
Okay, okay, so I just moved all that in,
Okay.
and we talked about the limitations. Okay. So this is all prior to, you got to get the informed consent, and the informed consent should consist of these things.
Okay. All right. So this is saying upon initial contact. I think this is for each session. This is like my take on it. Like you verify the identity, you obtain alternative means of contacting them, arrange for the patient. I mean, maybe we need to add one in here, Brenda, like you said, like verify the location.
I want to say I saw that somewhere further up though in a section, because
Okay.
that's the separate verifying of location that
Okay.
you actually,
It
because
was
it doesn't
probably
occur
one
to
of the
the
ones
patient
that I-
that they can't change
It-
states.
It was probably in one of the ones I cut, frankly.
Yeah, but I'm talking about this meeting like, hey, you're not in Alabama today.
Oh, yeah, and you're right, it does have to be,
So I think
you're right, I
here,
think we
like
should say it there again.
initial contact.
Are we
for
talking about
session.
each contact?
Yeah,
Upon each contact, not initial.
So like
Okay.
we do with our meetings, we verify every time that the video's working, the audio's working.
right.
In your case, you would say, how do we reconnect if something goes wrong? Yeah.
And I'm gonna like throw myself under the bus here, but worked with a student, and after I had already seen them when they weren't in their right state, they said something the next week about, oh, well, I left that book that we were working with in another state. And I'm like, wait, when did that come about? And now now I ask every time I ask.
Okay,
That
so
happened to me in
letter,
COVID.
so letter B here needs to be verify physical location of client.
Yeah.
Yeah.
And we can even say like in Louisiana. Verify that the client is, in Louisiana.
Oh, okay, verify. But
Is it-
would that matter if, let's say, we go through with the compact and people are licensed to practice in other states? Then that won't matter, but you still may want to verify where they are. So you know which states your compact you're actually operating under.
Yeah.
Right.
Okay, so we can leave it like that. That's a good point.
Yeah.
My only concern with just leaving it like that, everybody's going to interpret that a little differently. And, and so,
Agree.
Right.
geographic location or something, because they're like, I'm at home.
I'm at home. Yeah, you're right.
Or to put the reason why we're verifying it.
Maybe for emergency purposes is part of it. In my opinion, I would say I do child stuff and I need to know for emergency purposes. Mostly mine is if they have a heart attack or if something goes on, or if they seem suicidal, I need to be able to call 911, or if they do something in a home alone, I need to be able to call for somebody to go to 911.
So could it be verify physical location of the
address.
client, and then like for purposes of
Emergency,
emergency contact and assuring they're in a state you're licensed to practice in.
right.
Yeah, licensing requirements.
And licensing
Maintaining-
requirements, there you go.
I like that.
I think usually if people know why we're asking or they're having to do something, then we're likely to do it.
Yeah.
This may be nitpicky, but it doesn't have to have address because sometimes they don't know the address or
I would say
something.
just physical location.
Location.
Right. Because maybe they're living at the Holiday Inn. They're not going to know the
Right.
address for.
Gotcha.
Okay. I think you can put a contact in the OT practitioner on C.
Contacting,
Oh, practitioner.
the,
No.
arrange, this one that starts with the word arrange?
Yeah,
Oh, I see, OTP, all right, yeah.
uh-huh. And then E would be who to contact for an emergency. Okay,
Wait, E, provide contact methods of alternative communication.
so if you have a heart attack, who am I calling?
No, I know what we're trying to say, but it doesn't make any sense when I read it. Okay, wait, that time I read it, it made sense.
Maybe or licenses instead of and or and.
No, I was down on E and it makes sense
Oh,
now.
okay.
Sorry.
Well, Brenda, it really doesn't make sense to me.
Okay.
Um,
So the patient shall.
should
and
we
are
say
going to
emergency
client?
contact?
Yeah,
'Cause
provide
alternative
emergency
communication
contact.
can-
There you go.
Provide emergency contact.
Well,
Provide contact for emergency purposes or
all right, provide.
Emergency contact information.
yeah, emergency contact information. That's
There
who
you go.
that's all the forms say.
All right, and then take out the first contact.
Yeah.
We're saying the client's gonna provide us with the emergency contact.
Yeah.
Right,
Right.
right,
So
yeah.
like,
But it starts with the, well, actually it starts with
Patient.
patient, but it should start with the client shall like do all these things.
yeah,
Or maybe, okay,
they
the
provide.
OTP,
Yeah.
But do you
So,
need that if we say it in B?
No, that's just the location. So like where are you today? Oh, I'm at the library. Oh, I'm at the Holiday Inn. Okay, well, who do I call in case there's an emergency?
right.
Like if you have them standing up doing stuff, they get dizzy and they fall and hit their head. Who am I
Yeah,
calling and where are you?
I don't have this written well here for E.
It's fine.
If we
Just
need
keep
to
going.
phrase it-
I'll clean it up. Just keep going. I
Okay.
know it's 1 o'clock, so I'm trying to like just kind of get through it and I'll go through
Okay.
and format and clean it up.
Got it.
So 7 is the practitioner providing services must A, exercise the same standard of care, provide services consistent with the Code of Ethics and the ethical standards of practice, and comply with provisions of OT Practice Act and its regulations, secure and maintain confidentiality of medical information required by HIPAA and the provision of OT services by telehealth and state and federal law. The nature of the service delivery as being performed through telehealth should be thoroughly documented. Have procedures in place to address remote medical or clinical emergencies. Maintain current competency in the practice of telehealth through continuing education, consultant, or other procedures in conformance with current standards, or be proficient in the use of telehealth and or telemedicine. Since we're not requiring, like, some states require, like the G would be, they would require 2 hours of continuing education in telehealth practice if you're going to do telehealth. So if we don't want to do that, we would take out G, and then F, maybe just use the second part of be proficient in the use of telehealth thing.
I like that.
So take out half of F, first half of F, and then take out G. I just want y'all to be aware what the other states said. That's why I
Yeah.
included. I'm not saying that we should do all this, but just for us to be like, oh, and don't know if one of y'all would be like, hey, I think we should. Okay,
I thought, if you're doing telehealth, there's no need for you to keep having continuing education
Right.
each time you
Correct.
renew your license. So,
Right.
I agree.
Right.
I mean, maybe initial, but not each time.
Yeah. Okay.
So we're
get
getting rid of
G.
G.
Yeah. And then 8, audio and video equipment must allow for interactive, real-time communication which permits with the OTP and the patient to see and hear each other. Any telehealth technology used by a practitioner must comply with confidentiality. Kind of already said that. So
We've got all of this already.
yeah, so you can just take that out. It's just another way of putting it.
Mhm.
Yeah. And then that's it, because this was to help Ingrid. I sent you that, Ingrid.
Oh,
And yeah, I sent Ingrid that. I found that and I was like, oh, Ingrid, look, this is what Texas says. You can just delete it. I just put it in there. Just I didn't know what we were doing first. But
Again,
I think
Darby,
that's-
thank you for consolidating the
yes, I
information.
love it.
Yeah,
Like, I don't know that my brain could process through
And that
this
was
if it
so
wasn't
much work. That was
pre-consolidated.
awesome.
yeah.
thank
And
you,
I mean,
thank
if
you.
you have questions or if you want to, that's why I send you the original document,
Mhm.
you know, so you can read through and then I try to highlight what I took. I'm not great at, I always highlight because I go through and highlight it first and then I like pick and choose, but I'll go back and tidy this up so we can vote on it and format it. And then once it's approved, so Ingrid can add in the supervision of the non-licensed personnel to the rules, if you don't mind doing that, Ingrid. I'll clean this up. We can vote on it for the next meeting. And then what of the list? I'm guessing the thing that we should tackle next would be the very end of the rules and regs that we've never even looked at, which is just the unauthorized practice prohibitions and causes for administrative action. So we'll look at that last page and a half, and then we'll go from there with our list. That shouldn't take the whole time. The other things on our list are use of the title of doctor, foreign trained OTs. We have a note by the temporary license section. And somewhere in here, maybe in this next part, that we want to put that the rules and regs have to be updated every 3 years. So that core committee doesn't have to do this whole document in its entirety for the first time in however many years. So, sound good?
Yes.
Okay. So, basically, do we have any public comment?
No,
No. Okay.
I'll try to have something drafted about foreign trained therapists.
We have some stuff in the rules. so
We
make
have
sure
some
you
stuff
look at
in
that.
there, yeah, so I'm just gonna look at and any other thing, AOTA or anybody else, and I'll come up with something about foreign training.
Okay. And I'm gonna revise this part. So if you just send me this, that would be great. The and I'll format it and fix it.
Yeah.
And then we can vote on it. All right. Any other questions, comments? I'm sorry, I went over, but we're all good. All
Thank you.
right. The next meeting is September 15th, 2023. I think I will be coming to you live from Florida in that visit, but we'll be in touch in between. And just so you know, I did want to let y'all know that I took it off the agenda, but Dr. Van did send a response to that last practitioner asking all the
Okay.
questions about the script length and remember she had like Elizabeth Duncan had like 5 or 6 questions. So he addressed that. All right, so meeting will be adjourned at 1:13.
13, all right.
thank you.
All right, y'all have a good rest of your day. Bye.
Thanks, guys. Have a good
Bye-bye.
weekend.